Welcome to an essential overview of the various neck incisions used in surgical procedures. Understanding these approaches is crucial in head and neck surgery. Neck incisions are precise anatomical cuts that allow surgeons access to structures like the thyroid, parathyroid, larynx, and major blood vessels. We will explore general incisions, specialized approaches for airway and cancer surgery, and incisions used for vascular and spinal procedures. The choice of incision is dictated by the specific anatomical structures needing intervention, whether it's for gland removal, airway establishment, or tumor resection. Let's start with the most commonly used, general neck incisions. The transverse cervical, or Kocher's, incision is a horizontal cut in a skin crease in the lower anterior neck. It's often used for thyroidectomy, parathyroidectomy, and limited neck dissections. The vertical midline incision runs straight down the anterior neck. Key uses include emergency tracheostomy, esophagectomy, and anterior cervical spine surgery. Next, we focus on specialized incisions for airway management and major head and neck cancer surgeries. The transverse tracheostomy incision is specifically placed to access the second and third tracheal rings, making it ideal for establishing an airway, whether electively or in an emergency. McPhee's incision is a low, curvilinear incision used for total or partial laryngectomy and neck dissection, providing wide exposure for cancer surgery. The modified Blair's incision begins near the ear and follows the jawline before extending horizontally. It is the primary approach for parotidectomy and other mandibular surgeries. The hockey stick or apron incision is a combination cut used for extensive bilateral neck dissections, often required in advanced head and neck cancer cases. Next, let's review incisions crucial for vascular access and diagnostic purposes. The carotid endarterectomy incision is vertical, following the border of the sternocleidomastoid muscle. Its primary use is to remove plaque from the carotid artery, preventing strokes. The cervical lymph node biopsy incision is a small transverse or oblique cut used to remove lymph nodes for diagnosing diseases like lymphoma or cancer metastases. Finally, we cover the standard approach used for cervical spine procedures. The anterior cervical approach uses a transverse incision parallel to the clavicle for procedures like anterior cervical discectomy and fusion, commonly treating herniated discs or cervical stenosis. We've covered the key neck incisions, from the common Kocher's cut to specialized approaches for cancer, airway, and spine surgery. This knowledge is fundamental for successful surgical outcomes.